Hi, I'm Gordy Little for Hometown Cable. We're at CVPH Medical Center here in Plattsburgh to record a special news conference today, scheduled to begin in the Medical Center boardroom at 1 o'clock, about 20 minutes from now. The news conference today will include representatives from CVPH Medical Center, the Adirondack Medical Center in Saranac Lake, and representatives from the Elizabethtown Community Hospital. The published purpose for the news conference today is, quote, to discuss the short and long-term potential damage that will occur regarding local health care delivery if some of the proposals being considered in Washington come to pass. Contemplated reductions in reimbursement could easily result in the programs and services now offered by local hospitals being lost. Chief executive officers of the three facilities are scheduled to speak today, as well as Dan Ashline Bodette, who is president of 1199 SEIU at CVPH, that's the Service Employees International Union. As always, our primary contact for information here at the local medical center is our friend Mike Hildebrand, Director of Public Relations and Marketing. As I said, the news conference is scheduled to begin today at 1 o'clock.
I guess normally when we do this, I would say it's my honor and our pleasure to welcome you here today. I would wish you happy holidays and say I wish we weren't gathering like this. This is probably the best way to start this out. We very much do appreciate you coming, but we're here on a really serious topic, and I think most of you have covered and reported on the fiscal challenges that our organizations have all faced over the past 12 to 18 months. And, most of us have been through a very difficult year. Our employees have struggled through that with us. We, as organizations, have gone through staff reductions, restructuring, and looking at all aspects of our operations. And that's going on the kind of past environment, what's going on in 2012. And what we wanted to just bring to everybody's attention is the looming discussions over the fiscal cliff, over some of the budget battles that are going on, and what some of the ramifications for those reductions might be. I'd like to introduce Chandler Ralph from Adirondack Health, who's here today just to talk a little bit about their experiences and some of the things that they're concerned about. So I'll turn it over to Chandler.
Good afternoon. I want to thank everybody for coming out today. This is an important issue, not only for our hospitals, but for the communities that we serve. Healthcare throughout the region has really been transforming. We're in the medical home demonstration project that is trying to transform primary care and how we take care of our patients to take costs out of the system. And that takes a certain amount of time to move that ship, if you will. And what we're facing now down in Washington is some of the most horrific cuts I have ever seen in my, I hate to say it, 40 years of healthcare. If you took all the cuts that they are proposing down in Washington and totaled them up for 1 year for Adirondack Health, it would be over $4 million. And when you get to that point of cuts and you look at that, it's no longer can I, tweak the system here or there. You have to take a scalpel to the services that we deliver in our community. That's how serious this is. And we all understand, we all stepped forward during the ACA. Hospitals gave up $155 billion in the ACA. We took that hit for the right reasons to get people insured in this country. And now to come back with so many other proposed cuts in Washington are just really, really tough. So the reason we're here today is to bring attention to those cuts. The fiscal cliff and the taxes sort of overshadow the other cuts that are being proposed in Washington. So we really want to make sure that you know we're speaking with our elected officials almost daily, and we urge the public to do the same. I mean, your healthcare and the healthcare systems in our community are so important to the economic vitality as well as the health of our community. I would like to say that we're very fortunate to have Congressman Owens with us. Although he is not in the majority party in the House, he really every single day, I think, is fighting to limit the cuts to health care. And our representative, Chris Gibson, who has also been working tirelessly in the House to help us, so we want to thank him as well. And Senator Schumer has been a rural health champion for us. He's fighting very hard for two particular cuts that would be devastating to Adirondack Health. So we want to thank him also. We're really grateful to them. I think as we're looking what happened this year, if you take a look in total, all the total layoffs that occurred in the North Country and around the North Country, it's 280 jobs. That's huge for the North Country. Our population is not dense like the suburban and urban area. And just that alone affects the economics in our community. So as we take a look going forward at cuts that are much more devastating than anything we've ever seen, it really makes us all frightened about what we can do going forward. If you take a look at Adirondack Health, we have 2 hospitals 8 miles apart. We do that because we're serving those communities. We follow our mission of excellent health care close to home. I think these cuts threaten that mission. And whether we can have small centers in Mineville, in Keene, in Keysville, and all the things that we do for our community, is going to be much, much more difficult to accomplish. So what's the solution? The good news is that we as healthcare providers try to be pretty nimble in our community, and we are ahead of the curve in a lot of the things we're trying to do, such as the medical home. And for Adirondack Health, we just opened a wound care center for the region. So we continue to try and meet those. And I will tell you that these cuts have the possibility of devastating our ability in the future to be able to reach out to our communities. So I thank you for that and turn it back over to Stephen.
Okay. Jane Hooper is here. Rod Bula is ill today and couldn't be here. I know that we were in meetings all day yesterday with kind of our beginning relationship with Fletcher Allen Partners, and talking about ways that if some of these cuts come across, how do you save some of the monies out there? And it's a very daunting task. And I don't think that there is saving that. I think that we'll be looking very seriously at different programs and not able to just do some type of adjustment to our staffing mix or something like that. We'll be looking at very serious things. Dan Ashland Bedeau is here, and he is with a nuclear medicine tech, and is president of our union here. And he and I had the privilege of being in Washington, D.C. last week, and would like him just to talk a little bit about his experiences down there.
I will keep this relatively brief, but I didn't actually know Mr. Mundy was in Washington the same day I was, but I went down with a representative group from SEIU, Service Employees International, to talk to our congresspeople. So we spoke with Congressman Owens and also Congressman Reed from the 23rd Congressional District, and we let them know that we are standing shoulder to shoulder with Haney's, with our hospital, with the other unions in the area, to say that these cuts are going to be draconian and they're going to be awful for the care of our patients, for our employees, for our communities. We cannot tolerate them. We got a good response from Congressman Owens. We've always felt that he's on our side. He's on the side of health care. He's on the side of our people in our area. Congressman Reed, on the other hand, would only commit to the fact that he was interested in the fiscal cliff as far as generating revenues. He was for it. As a Republican, we took that as a plus and went away fairly happy. We did our best to express our concerns and those of our constituents, and those of our members, and those of our managers who are trying to have a community hospital that does the right thing for the people, and that's to provide the best quality care that we can give. And we expect to be paid for it. It's not free. We know it's hard to come up with the monies to pay for this. They have to find a way. Please don't cut our Medicare.
Thank you. Thanks very much. And I think that what you see here is a real solidarity behind the way we operate between SEIU and Sandy Gwinnett wanted to be here today. She's actually with NASNA, the lead NASNA rep here for the New York State Nurses Association, but had to be in Potsdam, and feels equally as strong about the collaborative nature of this. I go to DC several times a year, working on various issues related to healthcare and CVPH, the North Country region. And I normally come back from it challenged, but feeling up to the task. I have to tell you that the overall mood and tenor of discussions gave one, it was very difficult to come back feeling anything other than impending doom. And I don't say that lightly, and my staff would echo that. There was not one item talked about in our meetings that indicated that they were looking anywhere other than healthcare to recoup many of these monies. And we have done a number of things here on our nursing units, in our management structure, with layoffs, et cetera. And we don't think that we're going to be able to do that just by adjustments like that. And we're going to be very much pushed to make very serious decisions about services that we lose money on. And you know, we wouldn't be remiss if we talked about them specifically, but I think that it's very serious, and any hospital operates in a situation where we have services that cost us money and ones that make us money. So
Sorry.
That's all right. So that's literally what we're looking at. I would be happy to take questions on this. I think that we're just trying to get the gravity of the situation in front of the general public.
Stevens or Chandler, I know that they've been talking about Medicare and Medicaid cuts. Can you explain, delineate, expand upon the specific cuts that you
Sure.
are worried about?
I'll give you an example. We, Adirondack Medical Center, Adirondack Health, CVPH, are sole community hospitals. And it's a federal program that recognizes the nature of rural medicine, and whereas there's nobody else. There's not two hospitals that can work providing services. There's one. There's nobody else anywhere around you. They define that as within 35 miles. The additional reimbursement we get quantifies to about $15 million a year. And if you look at what's gone on in the past year, we're dealing with a $5 million budget deficit. So multiply what's going on here by 3 if that program went away. You know, if they up the mileage limit to where you had to be an hour apart, we're 50 minutes. You know, that would be a draconian move for us, and would really reshape what goes on at either one of our organizations. And Chandler's organization qualifies the same way. Maybe you could speak to that.
Yeah, and we also are subject to potential cut as a Medicare low-volume hospital. A lot of rural hospitals get this enhanced payment to cover the fixed costs, even though we don't have the same number of Medicare patients. It's called a low-volume adjustment. That's a $900,000 cut in 1 year for us. So you couple that with the sole community hospital take back, we're looking at incredible amounts of cuts.
That kind of ties into one of the questions I had. It does sound like for rural hospitals, the cuts are more severe.
Yeah, they are. They're looking at medical education, which to a teaching organization would be devastating. The government supports through what's called GME, Graduate Medical Education, and Indirect Medical Education. They're two different programs, which don't affect any of us, but would have a serious impact on the number of, you're in a position where there's a physician shortage and you want people to go into medicine, and you're going to cut down the monies available for training. So you're going to have less people able to go into it, which is going to exacerbate that physician shortage that crushes our region. And another program that's out there is called the Critical Access Program. And this is a program for smaller hospitals like Elizabethtown. And Elizabethtown has done a tremendous job. If you look at some critical access hospitals, they're very much around an inpatient unit. They've developed an amazing array of outpatient services and outpatient clinics. They've just taken over the Smith House, expanded their primary care programs. That would be a very significant hit of about $4 million.
About $4 million over 10
10
years,
years.
I believe. And for a smaller hospital with a much smaller budget, it's a huge percentage of our total budget. I think with small hospitals like ours, part of what we do is it's a primary care facility, and part of what we do is we have employed physicians who have their physician practices locally, and we support those physicians. And if we didn't have those small community clinics in our neighboring towns like Willsboro or Westport, then what would happen to those residents who need a primary care physician in their community? Not only that, but like Stevens mentioned, we've started a lot of new services recently. So we're providing chemotherapy to people in our local area, cardiac rehab, and those are all programs that would potentially face cuts.
Other questions? Happy to answer. Thank you very much for coming today. We really appreciate it. We're available to answer questions one-on-one after.
Dan, how does this affect your union?
Well, obviously, if the revenues are not coming into the facility, we have to be concerned about how many positions they're going to be able to afford to keep. We've already had a couple layoffs here at this particular facility, and we have a concern that there may be more forthcoming. So as anything in this world happens, if it happens in an upward cycle, it's great. But in a downward cycle, like less revenues, fewer jobs, fewer spending in the community, it goes round and round in a wrong direction, which is down. So we're really concerned about how our members are going to be affected financially and how it's going to affect our community and our patient care. And that's our primary focus, is the patient care.
None of us know when it's going to be resolved, if it is resolved.
That is correct, and that is exactly what I was hearing from both congressmen I spoke to, Reed and Owens, when we went to Washington a week ago, that they're not exactly sure how it's going to play out. But I have Congressman Owens' word that he's going to work diligently to try to protect as much as he can for our area and for our hospital. And I'm optimistic that he'll do the best he can, and that's all we can hope for.
A lot of members in your union.
We have over 1,200 members in our union.
That's unbelievable.
It's a good number, and
Yeah.
a lot of good, hard workers who are doing the best to provide quality care for the North Country, and they've been doing it for a long time, and they want to continue to do it. We'd like to see this community hospital grow and prosper.
Thanks so much, Dan.
You're very welcome.
Jane, it's so great to have you down here today.
Thank you.
The boss is not faking a sore throat, is he?
No, he definitely has a sinus infection.
I'm glad you got to say a few words anyway, because that little hospital of yours is not a little hospital anymore.
No.
It's doing a great job down there. I'm glad you mentioned some of the new innovations. And there are things to be afraid of.
There are. There's a lot to be really fearful of in terms of healthcare cuts. We, Elizabethtown Community Hospital is a community-based hospital, and we have primary care physicians who have their practice out of our hospital or out of the health centers that we own. And if we couldn't fund those health centers in those communities where people go for their primary care services, it would be detrimental to those communities. It truly would.
Well, all we can do is hang on to the cliff and hope for the best, huh?
It's going to be interesting. I certainly hope they don't push the hospitals over the cliff.
Have a wonderful holiday.
Thank you.
Thanks, Jane. Bye-bye. Mike Hildebrand, our program would never be complete unless we had a few thousand golden words from you.
Golden words, I like.
Oh, well. This is, the bottom line of this whole thing is a little bit scary, isn't it?
It's very scary because we don't know where it's going. And I think the one thing to keep in mind with all of this is that, you know, even though all of the hospitals locally are not for profit, we're all businesses. We have to be a business. We have the same bills to pay that everyone else. We have the same employees who expect to be paid. And we continue to provide care to patients regardless of their ability to pay. But that just puts more of a burden on us. And truly, you know, we're caught between a rock and a hard place because it's not as if we're in a position to set the prices ourselves. The federal government for Medicare and to some extent the state government with the Medicaid is actually telling us how much we're going to be paid, and they frankly don't care how much it costs to provide the service. We're already on many of the services with the current levels of reimbursement losing money to provide the service. You've got to make that up. And so when you're talking about significant potential cuts, it's like taking a meat cleaver to us.
We've seen so much growth and expansion over the years, and you and I have talked on Hometown Cable and on the radio so many times, and mostly we're taking 3 steps forward.
Mostly we are.
And we hope that this isn't 2 steps back.
Well, we certainly hope not, and I mean, frankly, one of the reasons that CVPH has had success and has grown so much over the last 20 or 25 years has been our ability to bring new services in that will generate revenue and that, in fact, will support the programs that aren't making any money for us. And it's a nice balance, but again, particularly when you're talking about some of the non-core services, if you're losing too much money, you just can't sustain it.
You know, and I was so glad that Stevens talked about the education component, because we are striving so hard to get top-notch physicians and other employees here. That's a factor that many people won't even be thinking about.
Well, Gordy, as you well know, physician recruitment is extremely difficult. You don't have a large pool of candidates, and you have everybody and their brother, including CVPH, really working hard to try to recruit, to bring people in. Now, you know, effective in early January, we're going to become part of Fletcher Allen Partners, and of course Fletcher Allen Healthcare is a huge academic medical center. And I'm not qualified to talk about how these cuts may impact them, but it sounds, you know, very threatening to them. I mean, they're in a position where they'd like to, I believe, expand the number of medical students they're able to train, and in fact that's part of the attraction for them with us. We provide some great clinical opportunities for them, but if they're getting their reimbursement cut, you know, that puts them in they're no different from us. They've got to pay the bills.
And you know, 10 or 15 years ago, neither you nor I nor Stevens or anybody would have dreamed that this marriage would occur. And yet here we are, and it's for the better of the greater community. There's no question.
There's no question that CVPH and Elizabethtown Community Hospital becoming part of Fletcher Allen Partners is a tremendous thing. And, you know, frankly, I think over the next 5 years you're going to see a number of other hospitals, both on this side of the lake and on Vermont, who decide, you know, becoming a part of that integrated healthcare delivery system makes all the sense in the world.
Chamber of Commerce has said for a long time we have to start thinking regionally, and this puts us on that track, doesn't it?
There's no question. It's you know, there's some strength in numbers. I mean, we know, for instance, that we're going to save significant dollars just on having much more purchasing clout. You know, there are a lot of opportunities for us with them, above and beyond just the mere fact that they have the ability to bring services over here that we would never be able to do. So I think it's going to be a very positive relationship.
I hope so. Thanks so much, Mike Hildebrand. Good friend. Have a wonderful holiday season.
Thank you, Gordy.
The media that were here for this news conference just before Christmas time, 2012, were handed a sheet with information before the news conference began, and I thought maybe as we're thinking about reflecting on what was said during this news conference today, that I might read parts of it, as the principals involved in this news conference are being interviewed by members of the various news media. North Country healthcare providers are uniting to urge elected officials to protect vital services and much-needed jobs being jeopardized by fiscal cliff and deficit reduction negotiations in Washington, D.C. That was, after all, the main thrust of this news conference today. The leaders of three North Country health systems, Adirondack Health, CVPH Medical Center, and the Elizabethtown Community Hospital, spent their time here today asking the public through the area media to join them in urging elected officials to resolve our fiscal challenges without sacrificing healthcare services and jobs in our region. Hospitals and nursing homes have already endured drastic cuts, the news release says. Further reductions will undermine our ability to provide the community with access to care at the right time and in the right setting. Hospitals and nursing homes in the North Country have already accepted $320 million in funding cuts over the next 10 years as part of the Affordable Care Act and other adopted Medicare and Medicaid cuts. The realities of health care reform have also resulted in the need for several hospitals in this region to implement long-term restructuring plans, which you've no doubt heard a lot about, including reductions to their workforce in order to continue providing a high level of patient-centered care to their communities. Healthcare providers in our region would be hit with an additional $482 million in cuts over 10 years if we go over that fiscal cliff that everybody's talking about at the day we're recording this news conference. In 2013 alone, and that's coming up very soon, other Medicare payment policies that have expired or are set to expire represent an additional $11 million in losses for hospitals in the region. And I'm sure you'll be hearing various angles on this story in the newspapers, on the radio, on television over the next few days and weeks. And at least it's something to think about, because apparently everybody in the North Country has a stake in what happens here at these various medical centers in our North Country region. We thank you all for watching today and for watching Hometown Cable, and we enjoy your suggestions anytime in the future. Have a great day, wherever you are.
Cancellations and all kinds of stuff still.